Hello everyone and welcome to our webinar. My name is Jordan Stark and I'm part of the marketing team at Canadian Fertility Consulting, and I'm happy to be here with our two speakers today to talk about surrogacy in Canada. We have lawyer Ellen Embury from Carbert Waite LLP in Calgary, Alberta, Canada. Today, together with her partner Rachel West, they are Western Canada's leading team in the area of surrogacy and fertility law. Ellen and Rachel have helped thousands of couples and individuals of all backgrounds and sexual orientations to become parents. They work with intended parents, surrogates, gestational carriers, egg and sperm donors, and also with physicians and clinics across Canada and the United States. Ellen is regularly asked to lecture on surrogacy and fertility law across Canada and around the world. Ellen and Rachel pride themselves on delivering caring, cost-effective services to all of their clients, both domestically and internationally. We also have Leia Swanberg with us. Leia is the founder and CEO of Canadian Fertility Consultants and Egg Helpers. Leia is a mother to 5 and a 2-time gestational surrogate and a 6-time egg donor. She began Canadian Fertility Consulting in 2007 after her second surrogacy with the intention of creating a more rewarding surrogacy experience for both intended parents and surrogates. With a background in business development and management, Leia turned her personal passion for alternative family building into a full-time business. CFC believes that surrogacy is more than a medical transaction. Bringing one's child into the world through surrogacy is a milestone that deserves to be honored and celebrated. Now, before we get started and while we wait for a few more attendees to join us, I'm just going to go over a few housekeeping items. Number one is we know that everyone is at home right now, so in the event that you have any internet connection issues, please call in using a phone. You can call in using the phone number in your registration email so you can still participate. Item number 2 is that we would like you to be aware that we are recording this webinar today, and everyone who registered will be sent a direct link to watch this again later, along with the contact information to book one-on-one consultations with Ellen and CFC. And last but not least, we are encouraging everyone on this webinar today to please ask questions if you have them. Ellen and Leia are here to answer them. There is a go to webinar questions button where you can type in your questions for both of our speakers, and we'll be answering these questions live today. Now, we have a lot to cover, so let's get started. I'll invite Ellen on screen now. Hi, Ellen.
Hello, thank you so much, Jordan. Thanks so much for having me. I'm delighted to be able to talk to you about surrogacy in Canada. Normally at this time of year, we would be in Europe or in Scandinavia. I have a special connection with Scandinavia, given that my mother is Norwegian and we have a house there. But for now, we're just doing it from our office in the hope that we'll be able to come to you soon. As Jordan indicated, I practice surrogacy and fertility law in Canada. I've been doing that for roughly 20 years. We've helped thousands of families become families, and we love it. It's happy law, and sometimes lawyers don't get to practice happy law. So I'm very, very happy to have this job. What I want to do is really just deal with some of the high-level questions that I get asked about pursuing surrogacy in Canada if you are an international couple. So the first thing to know is that surrogacy in Canada is altruistic, and what that means is that unlike in the United States, the surrogate is not going to be paid. She doesn't get a salary for being your surrogate. She's not allowed to profit. What she does get is reasonable reimbursable expenses for the pregnancy. Now, I want to be clear, altruism does not mean austerity. That does not mean that she's required to have the cheapest of everything, but she does have to produce reimbursable receipts to show that her expenses are reimbursable. One of the advantages of surrogacy in Canada is that it is regulated. The government is interested in it, and that creates safety. That creates safety compared to some other jurisdictions in the world where you might not have a government interest in surrogacy. In terms of Canada, clinics have high success rates. There's a very, very high level of support for same-sex couples in our medical system and socially, which is an advantage. I think that in the Canadian model, you typically see very strong relationships between the intended parents and their surrogate, which I think is an advantage of the Canadian system. And then, of course, we have the Canadian healthcare system, which is one of the best in the world that we're very proud of. So you can be assured that your surrogate is going to have safe medical care. And finally, one of the biggest advantages in my mind is that your baby will be a Canadian citizen and people like Canadians. So we're very pleased to be a good environment to offer surrogacy in. As a lawyer, what I like to do is just head through the top 5 or 6 questions that I'm typically asked. And again, I would encourage you at the end of the presentation to send emails in, or I can do one-on-one consults, which I never charge for. So the idea is that you should have a good understanding of what of the process ahead of time before you start it. So number 1 question is always, what will the birth certificate look like? The answer is we can be flexible. If you are a same-sex couple, 2 men, normally we will put both dads on the birth certificate. But you may live in a jurisdiction, in some cases Italy, some other countries, where it's not going to be acceptable for you to have 2 men on the birth certificate. And so in that case, we can either potentially leave the surrogate on the birth certificate or only put the genetic father on the birth certificate, or do something like that. If you are a single parent, if you're a single dad, we can have only you on the birth certificate. The surrogate would never appear on the birth certificate. The bottom line is that we can be flexible. There are some countries, for example, the Netherlands, where it is absolutely necessary to leave the surrogate on the birth certificate for the purposes of Dutch law. That is doable from our perspective. We just need to know around the time that we're doing the contract, so that there's no surprises at birth, what your home jurisdiction is expecting to see on a birth certificate. But the takeaway message there is that we can be flexible. The next question that I am always asked is, how long should I expect to stay in Canada after the birth? Right now, I had a baby born 2 weeks ago. The parents have their birth certificate. They have obtained their passport, notwithstanding that we have some delays and some closures associated with COVID. And so they're hoping to return to their home jurisdiction. It's just that flights are a bit of a problem now. Absent COVID-19, the normal expectation is that you would be in Canada for a minimum of 14 days or 2 weeks after the birth of your baby, usually up to a maximum of about 30 days or 1 month. That is a reasonable time to expect to be in Canada after the birth of your baby, absent COVID situation. I'm often asked about what the process will look like at birth, and that really does vary from province to province. And I'm happy to deal with it at a high level. There are some provinces that you need to get a court order in. There are other provinces that you do not need to get a court order in, and this would be an order from a judge saying you were the only parents of your baby. The surrogate is not a parent of the baby. It's a bigger discussion than a high-level webinar, but I would always be happy to answer one-on-one questions about specific jurisdictions. And on my website, we do have a summary of the process in the various provinces. In terms of costs, I'm usually asked, how much is this all going to cost in Canada? It is an important thing to think about. Again, I'm not going to deal with it item by item. I do have on my website a PowerPoint, which is about 8 pages long, and it deals with what are your anticipated expenses for surrogacy and egg donation in Canada. And I do try to estimate them at the high end, because we want to make sure that you understand that there should be a little bit of margin built into your budget. Probably the most important thing that you need to know from a legal perspective about surrogacy in Canada is regarding healthcare. The healthcare costs for your surrogate will be 100% covered by the Canadian government. Okay, she is a resident. Her healthcare costs, her doctor's visits, if she's in hospital, that is covered because she's covered by Canadian healthcare. Your baby's healthcare costs, on the other hand, will not be covered by the Canadian government. Okay, having a surrogacy baby is the equivalent of coming to Canada and having a baby yourself. And I realize that for my same-sex clients, that's a little bit harder to imagine, but that is the reality. Even though the child is a Canadian citizen, the child is not entitled to public health care. What that means is that you need to have insurance to cover your baby's healthcare costs, because the baby's healthcare costs could be quite significant if the baby is premature and requires medical care. We have lots of information available to you about an insurance policy, several insurance policies that can help you out in that regard. But again, it's just something to be aware of at a high level, and it's something that you will hear from your agency, potentially from your clinic, from the whole team that's looking after you. I'm often asked about surrogacy and egg donation contracts. With respect to egg donation contracts, the #1 question is, do I need one? I think that you'll get a different answer if you ask a doctor versus a lawyer. From my perspective as a lawyer, I think that it is important to have an egg donation contract, even if it is an anonymous donation, for 2 reasons. First, you want to protect yourself from liability if your egg donor is injured. Secondly, if there are medical problems in the future, you want to make sure that you have a commitment from her that she will assist in helping you sort out medical issues with your child. Obviously, we also want a legal agreement that says that she is prohibited from ever attempting to establish any parentage. And I don't want you to get worried about that because it's not something that you would typically see, but theoretically, there's always that risk. And so if there is a donation contract in place, you're protected from that risk. With respect to the surrogacy contract, our job as lawyers is really to think of everything. Our job is to think about, how is she going to take care of her body? How are we going to manage issues around travel? How are we going to ensure that the baby is born in the jurisdiction you want the baby to be born in? We will deal with all of these things, and we'll deal with some issues that you may not have thought of. We'll deal with expenses, of course, which I'm sure you have thought of, but we'll deal with things like, what happens if you both die while she's pregnant? How are we going to manage guardianship of your baby? And we do have to think about, how are we going to deal with issues around termination of the pregnancy if, for example, we have an abnormality. And sometimes I say, unfortunately, as the lawyer, my job is, like, while it is happy law, I do have to plan ahead and make sure that as you go into this relationship, you have all of the information that you need to ensure that you feel protected as you move forward, that you feel protected and secure. Our job, my partner and Rachel and I like to say that we want to make the process as simple as possible for you. We want to take out the scary factor. We know that you are entering into a legal relationship and a very intimate relationship in a country far, far away. And so our job is to try to make sure that you feel really, really comfortable about the process that you're entering into. So that is basically very big picture, very high level, what I typically talk about at an introductory level on the legal side. Certainly, I'm happy to answer any questions right now. And if there are any, Jordan, coming through, you can let me know. Otherwise, our link will be sent through to you. And as I say, we offer no charge consults. We want to make sure that you're feeling comfortable about this rather exciting process. What I can tell you is that right now, notwithstanding that medical clinics in Canada are closed, and I think that Leia will talk a little bit about this, the clinics are doing screening of surrogates via Skype. The expectation is that we're going to be up and running relatively soon, and so this is actually a great time to be thinking about, signing up with an egg donation agency, signing up with a surrogacy agency, so that you can plan to move forward once clinics open, which we're hoping will be probably within a month or 2.
That's great, Ellen. Thank you so much for that information. We do have a few questions here from some hopeful parents. The first question, they're wondering, does it make more sense to leave the surrogate on the birth certificate and the passport until we get home?
So the answer to that depends on where your home is. It typically does not make sense because it's possible. If you want to, it's possible. I sometimes have clients ask me, well, if we leave the surrogate on the birth certificate, can we get the baby's healthcare costs covered? And the answer is no. Parentage, the fact that she's listed she's listed on the birth certificate, is not going to allow your baby's healthcare costs to be covered. So the only reason that you would ever do that is if you were going to a country such as the Netherlands, in some cases Germany, or if you're where it is necessary for you to leave the surrogate on the birth certificate in order to establish Dutch citizenship or Dutch filiation social services. But typically it would not be necessary unless there's something very special and unique in your circumstances which require you to.
Okay, great, thank you. We do have another question here for you, Ellen. Is there anywhere in Canada that only my husband can be on the birth certificate because he is the genetic father? So are there any provinces in Canada where that would be the situation?
So there are two, if neither one of the parents are going to be genetically related to the baby, meaning you are using donor egg and donor sperm, neither one of the parents are genetically related to the baby, you can both still be on the birth certificate in the provinces of Ontario and British Columbia. Ontario and British Columbia do not require a genetic link in order to establish parentage in a surrogacy situation. In the other provinces, as long as one of you is genetically related to the baby, you will both be on the birth certificate. That's not going to be an issue. So again, this is more of a unique question. I would want to understand, and there is the province of Quebec. In the province of Quebec, it would only, in a heterosexual couple using an egg donor, only the dad would go on the birth certificate. And that is why Quebec is really a better jurisdiction if you are both related to the baby or for single men, for example. And again, I'm happy to talk about that one-on-one.
Wonderful, thank you. We do have one more question here. They're more just looking for a clarification on the pricing document that you had mentioned. The prices for the costs you were mentioning earlier, are they in Canadian dollars, American dollars, their dollar?
So let's talk about the Canadian dollar. Right now, the Canadian dollar, I believe, is worth about 68 cents US. The document that I have on my website makes it very clear, approximate cost in Canadian dollars. And what we do is we go through the categories of costs. And so those will be your clinic expenses, your egg donor, your surrogacy agency expenses, your surrogate reimbursable expenses, health insurance, which is also quoted in Canadian dollars, surrogates travel costs, legal fees, miscellaneous items, bed rest. Again, we try to go through it in a fairly comprehensive way.
Okay, wonderful. Thank you, Ellen. If anyone else has any questions for Ellen, please do let us know. We'll make sure that we can get you in touch with her. And now we'll have Leia join us on screen. Hi, Leia.
Hi, everyone. My name is Leia Swanberg. I'm the founder of Canadian Fertility Consulting, and as well as our partner program, Egg Helpers. And our goal is to help intended parents, either within Canada or abroad, build their families or add to their families through surrogacy or a combination of surrogacy and egg donation. I wanted to thank Ellen for being a part of this webinar and sharing the legal process with you, which for me really is the first step. When intended parents reach out to us, always our first point of contact or the first person that we'll put you in touch with is a lawyer in your jurisdiction, should we know one. Or if we don't, we'll put you in touch with a lawyer within Canada who will be able to connect you with someone within the country that you live as well. For us, ensuring that you are entering into a process that makes sense for you from a legal perspective, from a legal perspective, both in your home country as well as in Canada. Ellen had some questions at the end about provinces that would best suit those in particular circumstances. It is vital to the success of your family building journey to have all of that information before you find the surrogate, because there's nothing worse than finding a surrogate, whether through an agency or independently, that you love, but that just won't work. So thank you, Ellen, for tying up and sort of going over all of the legal process for those people who are watching our webinar today. So a little background on Canadian Fertility Consulting and Egg Helpers. I started the businesses after having been a surrogate twice and really was looking for something more. I felt I needed more support. I needed to have counseling available. I wanted to, have more than I did with the agency that I was a part of. And so I began CFC with one goal in mind, and that goal was to ensure that when people completed their journeys, that intended parents were able to walk away with a healthy child, and the surrogate was able to leave this experience with a great sense of pride, with an understanding of why she became a surrogate, and to move forward in her life, feeling as though she was fulfilled by the experience. And so CFC began. I then found very quickly that many of our clients required an egg donor as well. And for us in our egg donor program, it's important for you to know that our goal is that we find you an egg donor, we find you a surrogate that suits what you are looking for. Many of our clients come to us unsure of the difference between a known egg donor, so somebody that you would know throughout the process, that you would meet, who would be a part of your life, versus an anonymous donor, someone who you will not know and she will not know you. She will be identified by a donor identifier, and you will be listed as the parents, and that's it. It's a very closed process. And then the third type of donation would be an anonymous donor with open ID availability. And what that means would be you would have an egg donor. Initially, it would be anonymous. However, when your child reaches the age of majority, should you share that information with them, they would be able to search for the donor, and the donor would be comfortable with, with connecting at that point. And so for us at Egg Helpers, you will view a database of donors, you will see statistics on their previous donations, you will have their health history, you will have their education history, you will know about their hobbies and interests, and you will also know whether that donor is willing to be known or anonymous. And so I always suggest to people, first you're going to, connect with a lawyer and gain a comfort with the legal process. Then you would select an egg donor, and then you would select a fertility clinic. And we will make those introductions to obviously our sister company for an egg donor, and then to a clinic. And for us, when intended parents are looking for a clinic, it's really important that that you feel comfortable with the doctor that you're working with. We have another webinar that Jordan will link in this in an email that will go out to all of you post this webinar, which talks about how to select a clinic. Looking for a clinic with an infrastructure to support surrogacy. Looking for a clinic with high success rates around the surrogate process. Looking for a clinic that can speak your language. So if you're a non-English speaker, I apologize because I'm speaking English, but many of the clinics have non-English speakers, and for some people that's very important. And then as well, many intended parents come to us now and they say, we'd really like to work with a clinic who offers a guaranteed program. And a guaranteed program is one that you pay one fee and you're guaranteed a live birth, or your money is provided back to you. And so for us, whatever those requirements are that you would have of a clinic, our goal is to find that clinic for you and refer you, ensuring that you have a timely appointment, typically within a 2-week period by Skype, and that at that point you're able to ask all of the questions to the physician about their success, about the infrastructure they have to support surrogates, to ensure that they will take care of you even at a great distance, and what that type of communication looks like. So lawyer, egg donor, clinic, and then finally a surrogate. Our program, within CFC and Egg Helpers, we have 32 staff. We have a bilingual English-French program. So if you're a French speaker, we have staff that can speak to you in French. And as well, Ellen's partner, Rachel West, is also a French speaker. So it's absolutely a fantastic partnership there in terms of the French language. When you begin the process with us to begin looking for a surrogate, some people do that while they're looking for an egg donor, knowing that the wait time for a surrogate generally is about 6 months. Sometimes it can be as many months as 9. It really just depends upon what you're looking for in terms of the surrogate, what you're looking for in terms of her location, if that matters to you, what your termination values are should a medical abnormality occur, what your budget is around bed rest, around unexpected costs, should your surrogate become unwell and be unable to work due to a pregnancy-related expense. So you're going to have a full hour with a case specialist to really refine what it is you're looking for. And once we've done that, we will score your profile, your biography, against surrogates who come into our program. And in that scoring, we will look, does she share the values on termination? What are her bed rest costs? What is she looking for contact and communication during and after a journey? It's really important that those immovable values are watched out for. And so when we send you a profile of a surrogate who may be a good fit, we've done the homework, we've done the background. Any surrogate who enters our program will have provided that information to us. So we know that information before we introduce her to you. She's also completed a criminal record check. Her medical records have gone to your fertility clinic to be reviewed on paper. And she's had a consultation with an on-staff therapist for readiness. So she'll still require a full psychosocial assessment. However, this mini assessment is just to ensure that she really fundamentally understands what the next steps are, what this process looks like. And we want to ensure that any surrogate we match you with understands the process, is committed, is compliant to the requirements of a surrogacy program, and also is ready to partner with you at the level of contact and communication that you've indicated to us. So throughout the entire process, we are going to manage for you. This is the most intimate relationship, you will ever have with a stranger. We want to ensure that it goes smoothly and that it is built on trust, care, connection. So we will work with you on that. We will coach you to be successful in this relationship. You will also have a finance case manager. So someone who will go over, once you've had your call with your case specialist and before you're matched with the surrogate, you're going to have a call with our finance team, and they're going to go over for you all of the expectations, ensuring that you understand very clearly what the requirements are for our program, when your surrogate's reimbursement account is needing to be funded, how your surrogate will receive money, how we process her receipts for her reimbursements throughout the process. We want to ensure that before you move any further, before you're matched with the surrogate, you understand that process. It is so key to the success of your journey to ensure that you understand that piece. You will also be told and sort of educated around the laws in Canada as they pertain to matching with a surrogate. You don't pay us for matching, so you'll be introduced to a surrogate, and up until this point, you will have not paid us any fees. At that point, you will then have 10 days to get to know her before we reach back out and say, hey, are you interested in moving forward, paying our consulting fees in order for us to manage the process from there. And from there, she'll move to the in-person screening at your clinic. And from that point on, the clinic will take care of the medical process. However, we will follow along and ensure your surrogate understands the entire process, the medication she's required to take, the appointments that she's required to attend. And from there, we will move forward with planning for your pregnancy. We will also provide support to you throughout the pregnancy, to your surrogate as well to you. It is our goal always that we have insulated your relationship with your surrogate so that the details fall to the people that take care of them. So our finance team will take care of the finance, the clinic will take care of the medical process, the lawyers will take care of the legal process, and we will be your cheerleaders. We will support you, connect with you, care for you throughout the process to ensure that that you know what's next, that there are no surprises. We can never ensure a perfect journey for people. I really wish that we could. What we can ensure is that we will be alongside the entire time, and that if a tough issue arises or you need some additional support, you will get it, not only from myself as the CEO, but from your case manager, the finance team, or Jan Silverman, a therapist that we have on staff within our organization, who is available to you free of charge, as her therapy sessions are a part of our program. And so you will be able to reach out and access her once a week throughout your entire journey, should you feel the need, or once at the end, or once in the middle, whatever that looks like for you in terms of the support required. We have your back, and we want to ensure that you know that, and that we will be there every step of the way. Your file will remain open until your baby is 6 months old, and we do that because we understand that even post-birth, there are issues that sometimes arise. You may need assistance with the legal process when you get home, and so we want to reconnect you with that first lawyer. Your surrogate may need assistance. She may struggle with postpartum depression. She may require additional home care or bed rest, and we want to make sure that we're available to her throughout that time period. And so your file will remain open for 6 months, and it's probably hard to imagine now, but many of our clients have signed up to do second journeys sort of within that 6-month period. And of course, we offer a significant discount for that. And it's absolutely our pleasure to have clients come back. We've had, recently we had a client who has had their 4th child with us, or through us, with 2 different surrogates, but the first 2 babies were carried by one surrogate, and the second 2 by a second surrogate. And it really was just amazing to watch. And so I want to leave you with that, and I want to leave you with really the understanding that this is your journey, and anyone that you would partner with, whether it's CFC, Egg Helpers, another agency, or whether you embark on this journey independently, those that come alongside you to support you through this journey, their job is not to lead you, not to tell you, not to suggest. Our job is to really hold space for you as you make the decisions about your journey, and that we are there to support you. However, this is your journey, and we are a small part of it. And it is such a pleasure to play that small part in your journey. So thank you so much. If anyone has any questions, I'm happy to answer them now.
Thank you, Leah. We do have quite a few questions here that have come in for you. The first one, they're wanting to know, how long is a wait time currently for a surrogate?
So as I said earlier, generally it's 6 to 9 months. And, we will really coach you on how to create a great video so that, more surrogates are maybe interested because they really get to know you on video. We'll ask to share your video and biography on our social media platforms to build engagement as well. Generally, though, we see the wait time to be about 6 to 9 months.
Wonderful. We do have another question here. They're wanting to know, is it possible to have 2 parallel surrogates to have 2 children around the same time, or have a plan for getting another surrogate after, within 2 to 3 years of the first child?
Absolutely. So we have intended parents that do what we call tandem journeys. However, we find that it's tricky because, every woman's body is different. And so although we can go into it with the best intentions that the women will achieve pregnancies at the same time, that doesn't always happen. Maybe one surrogate will become pregnant and the next month another one will, and that would leave you in Canada for, sort of a significant period of time, as you'd need to be here for both births. It absolutely is possible, and we have clients doing that as well. Many of our clients, and I would say more of our clients, will end up with one surrogate and have a baby, and then oftentimes they will have that same surrogate carry for them again, or find another surrogate to carry for them for their second child.
Okay, great, thank you. We have another question here. They're wanting to know, can our friend come with us from Europe to be our egg donor, and can we still have a surrogate from Canada that way?
Absolutely. We have many intended parents who come to Canada for treatment for their own egg retrieval, or they have a sister, cousin, friend, and so that woman would still go through the same screening process with the fertility clinic to ensure that there would be a large number of eggs harvested. And so the criteria for an egg donor generally in Canada is under the age of 32, with an AMH of 20 or greater and antral follicle count of 20 or greater. And so definitely it's possible. And we actually have many people do that. One thing I would sort of add I would say the most important piece on that would be to really connect with a lawyer where you live to ensure that she that there's she has legal representation and feels comfortable with the process she's engaging in.
Okay, great, thank you. They're also wanting to know, do you have any recommendations for a fertility clinic?
Absolutely, we would love to connect you with an amazing clinic. And really it depends upon what you're looking for, what your needs are. And so during your consultation, we'll ask you about, sort of some fact-finding questions to ensure that any clinic we pair you with really understands what your needs are and is able to accommodate them.
Okay, wonderful. Thank you so much, Leah. If you have any other questions for Leah, please let us know. We'll make sure that we can get you in touch with a consultation with CFC. Once again, I'll be providing all of our contact information for the speakers today in the follow-up email along with the recording of the webinar. Ellen, would you like to come back on screen for a moment to say goodbyes?
Thank you. Thank you so much. We hope that you found this informative. As you may or may not be back at work yet, so you obviously would have lots of time to think about whether and where you're going to be pursuing surrogacy. And like Leah, just to reiterate, sometimes people are worried about talking to lawyers because they think, oh, well, a lawyer is going to charge me to talk to me. And I do want to reiterate, my partner Rachel and I are very, very happy to offer complimentary consults because it is really important that all of your questions are answered early in the process and you do feel comfortable moving forward. So we're not going to charge you anything for that.
Excellent. Thank you, Ellen, and thank you to all who were able to attend this webinar. You will be sent a recording of it and so our contact details to reach out to us should you want to connect individually. So again, thank you so much and have a great day.
Take care.